Services in Kenya, the issue of access to affordable health service has remained a riddle to many Kenyans. But in a bid to ensure that many Kenyans access health services, a number of community-based organizations have partnered with the Kisumu County government to ensure that more people access affordable healthcare services.
According to Victor Nonyango Tieno, the director of Inuka Success, a community-based organization in Kisumu, there is need for all stakeholders in the government and the civil society to be involved in resolving access to health issues.
The future of quality health that is embedded in our Constitution, Article 43, can only be realized when primary health care is actualized. And primary health care can only be actualized when the communities are involved in the implementation, planning, and monitoring. And so today we are here together with the office of Lake Region Economic Bloc. And what we are saying is that let's come together and reason it together. How are we going to make sure the newly launched primary healthcare strategy for Kenya is going to be actualized at the county's level, and that will be something that is going to be depicted only when a household is able to have quality life.
Otieno notes that it is essential to lay down elaborate plans that will compel the government to bridge the gap of lack of medicine in its clinic and hospitals, an issue he says largely affects the quality of services and trust in the government.
What are the mechanisms that national and counties are put in place to implement the primary health care? What are the gaps that are existing? And if these gaps are existing, what are the recommendations that should be explored by the county? And so what, by the end of this day, we are going to come up with a communique that is going to look at the ways in which the gaps can be fulfilled. We are going to call upon the county government, we are going to call upon the national government and other agencies.
According to Resmero Bara Okeyo, a stakeholder in health affairs in the Lake region, poverty is to blame for the rise of communicable diseases in the region.
The main issue that our governments are going to be working on is empowering the communities, the individuals, to have a better socio-economic level, because we find that the poorer people suffer more when it comes to these diseases. Looking at specialized services, not each and every county can afford specialized services. So the counties, through the governors, came together and said if one county can specialize in cancer care, then another county may take care of maybe infectious diseases, and all the other counties can use the same service.
However, she notes for the counties that have invested in health insurance services, they are able to deal with the rise of such diseases. At the same time, she urged the counties to employ more health workers to reach more citizens.
The current challenge, of course, is issues to do with the resources, financial resource. When it comes to health commodities, they are scarce, and also when it comes to healthcare workers, these are also not in adequate supply.
It's more of advocacy, so that there is funds, or the government or the county government allocate funds to ensure that commodities, especially commodities in the facilities, are available, so that any young person will not miss, let me say, a family planning commodity when they go to the facility, especially the government facilities, because they, as we know, they should be free.
Daniel Dembede, Look Up TV, Kisumu County.
All right.